This is just a fun project that kind of turned into more of a passion than I expected. But let's go through it because I want to try to get it done in the 15 minutes. So it's my experience, but it's really our future. So my disclosures, I happily own far too many pairs of Google Glass. I've gotten them over and over again as they improved. I'm a beta tester the last 6 months on the beta version that they worked on. I had to sign an NDA. It was like in cloak and dagger. I sadly do not own any Google shares. Our disclosures are this. The reason why I do Google Glass is because of this. As anybody who knows me as a safety chair, plastic surgery, this is reason we need to do what I'm doing. And that is what I call the no-touch technique. You know, Jelks talks, a good friend, about no touch in the eyelid. I talk about it post-op. If you're busy having to do things to patients because of complications, you need to change your approach. You know, Cirque du Soleil, in honor of my friend here, Jeff Roth from Vegas, I like their thoughts. They say they need 100% aesthetics with 100% safety, with no compromise. Because if you think about it, that is what they do. It's brilliant, beautiful, but it's safe. We need to do the same thing in aesthetic surgery. And I think that, to me, is one of the reasons why. The way you do it is outside of the box thinking with inside the box execution. What do I mean by that? This is a great book written by an entrepreneur in the Valley, Eric Ries, and we all know Millard's book. We need to understand our basic principles, and then we need to go beyond them and do what we can to go from building a new approach, measuring and learning. This is what Eric Ries talks about in the startup. We have to be a startup every day we go in the operating room. How do we do that? Well, I think the way you do it is you got to have self-reflection. You've got to look at yourself and decide what is working, what isn't working, and be honest. A very difficult thing for us narcissist people to do. And the point is, the engine to this is our self-reflection. You've got to do selfie videos. That's what I've learned in terms of this approach. It's one of the many ways I do it. And that's with Google Glass. So what happens? You know, you'd think Google Glass is dead. That's at least what you've read in the newspaper. Well, as you see here, you'd think so, but it's actually not. It's far from dead. As you see with Bill Gates, he thought 32 bits were as far as we were going to go. And the New York Times in 1936 thought that we weren't going to be able to get a rocket off the ground. This device was considered to have limited applications. We thought these liposuction approaches were not going to go very far. Well, the reports of Google Glass death is greatly exaggerated. Some version of this technology, it may not be Google, will definitely be in every OR. And my son's going to go into surgery. I can guarantee you all surgeries will be videoed in the future. There is something now called Google Glass at Work. That's where the iteration from the consumer has now entered. They found out totally by accident as they threw this out into the market that the enterprise industry, healthcare and others, have taken on Google Glass in a way they never dreamt. So forget about the geeky guy at Starbucks. It's going to be in our hospitals and in other institutions. So when you think about Google Glass, it's really just head-up display, as they call it, like a fighter pilot. Or now new cars have it on the windshield. Or in the operating room, I can see the vitals if I want it on my screen. So what is it? Well, there's the Google Glass. What I see is that. You see it actually, if you're watching me, you can actually see what I see backwards. And essentially people say to me, well, is it distracting as you were speaking? Well, you know what it's like? It's like a rear view mirror. It's there when you want it, and it's not there otherwise. I'll forget I have it on, and it's the whole case I'm using my Google Glass and forget it's there. I look up when I want it. So what's been my evolution? Well, there I am at my first surgery, and it was the first plastic surgical procedure accomplished with Google Glass, and it was streamed to both Stanford and UC in October 29, 2013. It was quite a lunar launch. It was very nerve-wracking to make this happen because it's clearly not, it's very, very beta. But you can see here in this video, as it's a video of the video, you see all the people watching at Stanford and UC below. There's my son at Case Western Computer Science manipulating everything, but without him and his Google Glass that I stole out of his backpack on the way to college again, I made this happen. And it was pretty cool. And everyone was sitting on their iPad or their iPhone watching my pinch procedure from their coffee table. I've done some modifications. It's a little bit wacky, but you need a lot of light for any good video. Normally you have those big lights in the room. They're hot. They're not where you want them. You want them on your head. The problem with halogen lamps is they burn out the video. So I came up with the camera light from a video camera and strap it to my head. And it's gotten bigger, but they're lighter, and it works. Now I'm walking around the area here today, and there's now some new small lights that I think are going to replace it. I also have a little 3M drape over the right side if I want to touch the Google Glass to control it, but it can be voice activated. And noise canceling headphones are important if you want to speak. It prevents you from having distracted sound. Well, why switch? Well, the fact remains that this is traditional surgical video, because even as you heard today on the facelift, you know, we tend to doubt ourselves. I thought, is this really true? So I said, let me get a video camera team in and let me just see the difference. So you can see here, I've got 3 cameras going. I got a couple of medical students. I've got myself, who obviously is the problem, because what the videographers want is me not to be there, because if I wasn't there, they'd get a great view. Hence the problem with traditional videography. Whereas you do this, you're done. I put on my glasses, all those guys are out of the loop. I don't need to set up my OR like you know, LA Housewives. It's done. Google Glass, what I see is what you see. So here's a good example. I compared this. I did a video recently for Canadian Meeting. And while they were doing their video, which was a $50,000 production to have these guys come in the day before and set up, I put my Google Glass on. I want you to watch the difference in the viewpoint of these 2 videos. So they're synchronous. I'm taking off some skin in the upper eyelid. On the left is the Google Glass. That's me. On the right is the $50,000 procedure. I think you can get the message. There's a problem. I'm in the way. And what they want is what I see. And of course, I'm in the way of that. So it's obvious that this is a better way to do video and a better way to record your surgeries. So let's look at this with this no-touch technique. Why am I doing this? Well, it's to learn, to build, and to measure. Looking at learning. Well, you know, we all need coaches. Athletes need coaches. The point is, why don't we have coaches, as has been written? And we should. And the point is, you know, that this tennis player, there's a serve. Tell me what he did to be so good. You cannot tell what he did. What you need to do is obviously slow things down. So what I'm doing now with my video is I'm looking at it in slow motion. I'm looking at it in stop action. That's when we're going to learn what surgeons are doing, not speeding by and not seeing what happened, how his hands are. Well, we're surgeons in the same realm as this elite athlete. So if you look at this was a perfect example of where I figured out from my Google Glass what happened. I was doing a canthopexy, which is part of my pinchplasty, and on the left side, I would always find that I would more often get a excess swelling. The suture would pull out. It wouldn't be as strong a pexy. Well, it turned out, I was talking to Glenn Jelks, and it turned out one day he was in a meeting, and he said, you know, you got to stand at the head of the bed, and he was talking about your position, right-handed people on the left side of the bed, that you need to make sure you're at the head of the patient. Well, I went back to my Google video and I figured out what I was doing wrong. If you look here, I'm putting the suture from top down at the periosteum. And so as a result, when I tied my suture, I was pulling it out, or at least pulling it against Newton's principles. So instead, in this video, which I did a couple weeks ago, I'm going from bottom up. So I'm following the circle of my suture, and I'm not pulling it out. That came with me going back to my Google Glass video and saying, wait a minute, which way am I doing this when I'm at the head of the bed? I was going the wrong way. So you can stop action it and see which way. Bottom line is that we don't want Big Brother to be watching, but we need to watch ourselves. We've learned that if we're watched, we all get better. It's no different when we're now at our age or when we were 5 years old. GIs have found that they inspect colons more often or more thoroughly as long as they're being recorded. So finally building it. Well, here's a Google Glass of my pinch rhinoplasty from yesterday. This is no big deal. I put my glass on and I use this for myself. I use it for my residents. It's a no-brainer. Or yesterday's pinch blepharoplasty. Put them on, do it, done. It's a simple methodology to record your surgeries, review them on your own like you would a tennis player or a golf player. It matters. to be able to do that and to use it for teaching purposes. And finally, to measure. So I've published these papers. A lot of it was based upon me analyzing my results. It's not just the still pictures. It was looking at my techniques, not just the end result. Am I getting there in the best possible way? Published this paper with this good friend right here, Chris Davis from London. And the fact is it reviews the literature very well. The Operation Glass I have on the web now. I'm trying to put my videos up there. I like it to be a congregant site for us all to put our video up there. What's the future? If I had my way, you couldn't be certified without sending up your last surgery from yesterday, because that's the best way to find out if people are good or not about memorizing an answer or preparing a book 6 months in advance. It needs to be contemporaneous. I'm playing with this right now, this 360 virtual reality, which is kind of interesting. This is from yesterday's facelift. You can see you get a 360. This is sitting on a tripod. I do nothing. I can move it around on my phone, and I can adjust wherever I want to look at that time in the OR at any part of the surgery. It's kind of a cool idea. I think it's very nascent. Eventually, this is all going to meld, and you're going to get a video of your surgery, and someone can just pull in and look at the anesthesia record, look at the OR nurse. They can look at the notes. They can look at the surgery. I think it's all going to be where we're going in the future. Holographic augmented reality. Obviously, you've heard about this. Cleveland Clinic is doing a lot of this with Case Western. Again, it's all beyond where we are now, but it's coming. So we're back to the principle of why I'm doing this. It's to reduce complications, get better results. It comes with your review. You know, Tiger Woods did not become that without reviewing his own work. This is something I show residents all the time back home, and I say, this is the last day of your residency. Looks good. You're there on the right with the light. Your attending's on the opposite side helping you. She's a great person. She's been a great stalwart supporter. What's fascinating in surgical training is that on your first day of your practice, they're gone forever. You suddenly it's been deigned. You don't need anybody to watch you. No one needs to teach you anything anymore. And good luck to you. So how about get glass? You need to find deliberate ways to train yourself to look at your work, analyze it, and get better. And we need to go from there to there. You've got to advance yourself, get into something that's going to be particularly useful for the sake of your improvement. Thank you.